Hello, and thank you for joining us. My name is Sarah Boyd, and I'm the president of Operation Truth Go For Illness Suffering Unite. Today is our first part of our 12-part series titled What a Vaccine Injury Looks Like. And why I wanted to do this series is because I talk a lot about what vaccine injury is and how it might occur, but we don't talk about what it looks like. So in my case, my vaccine injury has affected every body system, and there's 11 body systems. So in this 12-part series, including this, will be 12 different videos covering each body system, starting with the immune system. We're starting with the immune system, covering that topic first, because that's where my vaccine injuries seem to affect my body first, was in the immune system, which makes sense because that's this response that we're trying to achieve when taking a vaccine. So in case you don't know, the immune system incorporates the mucous membranes, which are found in your nose, your eyes, in your mouth, and other places, your tonsils, your lymph nodes, the thymus, your spleen, your bowel, your bone marrow, your bone marrow, and your skin. Its function is the first line of defense for your body against the different pathogens or germs that you could encounter. And then the second body system, and the second part of the series that we'll be speaking about, is the circulatory system. And that includes your heart, the cardiovascular part of the circulatory system, and the lungs, which is the pulmonary part of the circulatory system, your arteries, your veins, your coronary arteries, and your portal vessels. And of course, the function of the circulatory system is to remove any type of metabolic waste and toxins from the body while circulating blood to your essential cells that need it for every function of the body. The third system is the excretory system, and that includes your kidneys, your ureters that help excrete out your urine out of the bladder, and then of course the function of your excretory system is to remove any of those wastes and toxins from the body that the circulatory system has put into that excretory system. Then the fourth body system is your skeletal system. And in the skeletal system, it includes your joints, your cartilages, your tendons, your ligaments, and of course the function of your skeletal system is to protect your body and to help it stand erect. Excuse me. The medications I take are very diuretic, so throughout these recordings I'll be intaking more water so that I can speak with you without having my lips get stuck to my teeth. So the fifth body system we'll be speaking about is the musculatory system, and that includes your voluntary muscle groups that are your striated muscles, and then those smooth muscle groups that include your blood vessels, your bladder, and your intestines, and your stomach, and then your cardiac muscle, which of course is your heart. And then the function, it depends on what muscles we're speaking about, of course. And then the sixth body system we'll be talking about is the reproductive system. And I don't think I need to go into detail about what body organs the reproductive system goes into, but if you come back in 6 weeks, we'll be talking more in depth about the reproductive system. The seventh body system we'll be speaking to, and the most important, is the nervous system. And that includes your central nervous system, which is your brain and your spinal cord, or the peripheral nervous system, which includes the nerves that branch off the spinal cord and extend to all the parts of your body. Of course, the function of the nervous system is to control the body and communicate between its parts. The eighth body system is the digestive system. That includes your mouth, your esophagus, your stomach, your small intestine, your large intestine, and of course the anus. The liver, the pancreas, and the gallbladder are the organs that run along the non-hollow part of the digestive system. And then, of course, its function is to break down the nutrients that we intake, small enough for our body to absorb and use for energy, growth, and cell repair. The ninth system we'll be talking about is the I can't ever say this word, but it's the system involving your skin, your hair, your nails, your glands, and your nerves in your peripheral nerves. So the function of your skin system and all that's involved in that system is to protect the body's tissues and organs. And as we spoke earlier about it, it also protects from organisms infecting the body, from dehydration through sweat and otherwise, your changes in your temperature, disposing of waste materials through your sweat glands and otherwise, and then your senses for touch, pressure, pain, heat, and cold. And then your skin also stores your water and your fat. The 10th system we'll be speaking about is the endocrine system. The endocrine system involves the hypothalamus, the pituitary glands, your thyroid, your parathyroids, your adrenals, the pineal body, and the reproductive organs, whether you have ovaries or testes. And the pancreas is also part of this system. And its function is to produce and secrete the hormones needed and chemical substances that regulate the activity of the cells or organs. And then last body system is the respiratory system. And there's three major parts of this system: the airway, the lungs, and the muscles of the respiratory system. Of course, its function is to provide oxygen to the body's cells while removing carbon dioxide. So the reason why I went over those body systems is because it's important to understand going forward when explaining with all my medical diagnoses that have occurred, whether it's directly related to my vaccine poisoning or not. Excuse me. So next I would like to address, with each body system, what medical diagnoses I have. So as of July of last year, 2019, the VA has diagnosed me with the following medical diagnoses. So part of the first system we spoke about, the immune system, my first diagnosis was the vaccine poisoning. And then from there, it caused lymphedema with benign hardened lymph nodes in both my groin and my neck. It's caused a diagnosis of fibroblastic disorder, which are fibros in the connective tissue and organs. And then as a result of my lymphedema, I have decreased lymphocytes as well. Then part of the circulatory system, I was diagnosed with Raynaud's phenomenon, immune thrombocytopenia, which is a platelet disorder where your body's own immune system attacks the platelets, a tricuspid and mitral valve regurgitation, and then varicose veins in both my legs and my abdomen. And then part of the skeletal and muscular system, I was diagnosed with arthritis of my jaw, some type of muscle disorder. They're unsure of what yet. Retropatellar pain syndrome, which is the Army's way of reoccurring knee pain. Bilateral plantar fasciitis of both my feet. Posterior tibial tendon dysfunction of both Achilles tendons of my ankles. Degenerative disc disorder throughout my entire spine with bone spurs, disc bulges, fissures of the L4, L5, and S1, facet arthritis throughout my entire spine, straightening of my cervical and lumbar spine, neuralgia of the sciatica nerve, radiculopathy, and cysts that have been found in multiple joints throughout this entire process since 1998. The next body system is the excretory system, and those diagnoses are the overactive bladder with incontinence, painful bladder syndrome, cysts that have been found in both my urethra and kidneys. And then in the reproductive system, I've been diagnosed with endometriosis, pelvic inflammatory disease, dyspareunia, which is a pain of the other areas of the reproductive system, cervical dysplasia without HPV. That's the human papillomavirus that they now have a vaccine for and are giving to individuals at the age of 12. And then I've also been diagnosed with some type of medically unexplained symptom involving the breast and lumpy breast disorder. I have multiple cysts in both of my breasts, and I've had a miscarriage with 2 very difficult pregnancies that I have 2 beautiful daughters from. And then the 6th body system I have diagnoses in is the nervous system. And those diagnoses include fibromyalgia, autonomic neuropathy, idiopathic postural orthostatic tachycardia syndrome, that's POTS syndrome. That's where you pass out by sitting from a sitting and standing up, or if you're just standing, you become lightheaded and pass out. Another diagnosis is trigeminal, or however you say that word, neuralgia. It's the facial nerve where you comes into the face and is causing what you see now is called facial fasciculations. It's like a tremor of the face where it's being impinged by an artery that we just discovered from our last MRI that I had this month in January. I've been diagnosed with tremors throughout my body, bruxism, where I grind my teeth at night, keratitis, which is why I wear these glasses. I have to wear these tinted glasses 24 hours, 7 days a week, especially in the evening hours of darkness, because of the contrast between the man-made light and the darkness is almost worse than the daytime. So that is why I wear these glasses. And so I've been diagnosed with chronic fatigue syndrome, restless leg syndrome, central nervous system complication, memory loss, anxiety and depression secondary to all my other medical conditions. I had an adverse reaction to a microcurrent therapy that landed me in the ER. Numbness with altered sensations and muscle spasms throughout my body. The 7th body system that I have diagnoses in is the digestive system. I have been diagnosed with IBS, intermittent dysphagia, which is a spasming of the esophageal muscle to help swallow. I have a fixed colon due to my endometriosis. I have due to a gastric emptying test, they found that I have slow churning stomach, so it's like getting bypass surgery where you're trying to lose weight, or my stomach is so small I can't even eat an entire sandwich in one session. So I've also been diagnosed with during a swallowing test, they revealed that I had pooling in my right vallecula and piriform sinuses, so I'm not swallowing everything when I do swallow. It's probably based on the intermittent dysphagia, but we haven't found a cause. And then I have found cysts in my liver, and then I have food allergens that I didn't even know about, that the VA just put on our problem list several years ago, of gluten and lactose. Excuse me. Then the 8th body system is the word that I can't say involving the skin. And I've been diagnosed with allergic contact dermatitis on my face and other areas. And then I have psoriasis with an abundance of melanin cells that shows up on my abdomen and back and other areas, but they have no known name for. And other disorders of the skin, including several topical allergens of potassium dichromate, a carbamix, gold, sodium disulfate, nickel, and mediazolidinylurea, balsam Peru, and benzoyl alcohol. Try to find these ingredients in the topical products that you use, and it's very difficult. If you have to look on their websites just to see what is in your different creams to use for moisturizers or to wash your hair, and you never know what you're going to be allergic to until it starts peeling your skin off or otherwise. I've been diagnosed for our next body system, which is the endocrine system, and I've been diagnosed with cysts in the ovaries, cysts in my thyroid, which I've had a biopsy and continuing to be monitored for multiple simple and colloid cyst nodules, one of which is now a TRIRADS5 cat solid nodule, which I'll be having another biopsy here soon for. They believe I have fatigue caused by some type of benign thyroid pathology of unknown origin. And then the last system I wanted to speak about was the drug reactions that I have. Because I don't specifically have any medical diagnoses of the respiratory system, I'm not speaking to that right now in this segment, but I have had several drug reactions that started during my military career, and my first drug reaction was Sudafed, which is a medication you take when you have allergies, and it's a stimulant, and the part of the Sudafed that I was allergic to is the pseudoephedrine. That's the stimulant, that's the added active ingredient in Sudafed. And then from there I found that I had a drug reaction to nortriptyline, Cymbalta, duloxetine, cyclobenzaprine, venlafaxine, gabapentin, methocarbamol, hydrocodone, and oxybutynin, just to name a few. These are the lists that are on the VA drug reaction that I am allergic to. And these are all different classes of drugs. This isn't one class of drug. These are opiates, these are muscle relaxants, these are anticonvulsants, antidepressants, serotonin and norepinephrine reuptake inhibitors, stimulants. Every different class of drug I've taken has caused me to have a drug reaction that has landed me in the ER with hives that have broken over 80% of my body, like severe medical reactions that I had to go to the ER to have assistance with. So all of these medical diagnoses that we're continuing to monitor, continuing to treat, and continue to seek therapy for, the only thing that I have found that I can take that I'm not allergic to is cannabis. And then I also take another medication that I just started because I became allergic to the oxybutynin that I've been taking for several years. When they changed the molecular makeup, I had to start taking a different medication to assist my bladder to stop spasming so it would work properly and decrease my pain in my lower abdomen. So cannabis therapy has been the only thing I've been able to use for a medical therapy. Now, if you know anything about cannabis therapy, you know that the body has what is called the endocannabinoid system, and that's the 11th body system I would like to speak to in this segment, because I think it is very important to understand why cannabis is so helpful for an individual with vaccine injury, and why it is such a needed benefit for anyone that is going through any of the diagnoses I just listed. So please stay informed, stay educated, and come back and visit us. Subscribe to our page, and continue to learn and grow with us as we continue our research and educate ourselves on what a vaccine injury looks like. As I said, I'm vaccine injured. I live it every day. I know exactly what it looks like. For any of you naysayers that say that this is from old age or from my own personal biological genetics, this is not anything that you would think is as a normal medical issue. This is a vaccine injury. I do have it listed on my medical problem list. The VA does say I'm vaccine injured. I'm vaccine poisoned is what they term it to be. So please, like I said, subscribe to our channel and leave us any comments, like our videos, and let us know what you think or what you would like to know more about. And we'll see you next week. Thank you for tuning in.